Today we will be starting with this MCQ which has been posted yesterday. So, which of the following statement regarding Whipple's disease is not true? So, statement number 1 states that dementia is the most common CNS manifestation. Yes, we have discussed just earlier that dementia is the most common CNS manifestation, and oculomastigatory myarrhythmia is pathognomic of disease. Yes, it is 100% seen in Whipple's disease, and it has not been documented in any other disease. So it is one of the pathognomic features of Whipple's disease. Type 3 and type 4 macrophages in Whipple's disease is consistent with persistent disease. And we'll go to the other option, fourth one, which is type 1 and type 2 macrophages is consistent with active form of the disease. So among these third and fourth option, which is going to be false statement. So we will be discussing in detail about the macrophages, and we'll come after the discussion to this. So yesterday we have discussed about the symptoms and the pathognomic features. So to proceed with that, next we will be discussing on the diagnostic features. We have to diagnose the disease. So in diagnostic management, most important aspect is that the intestinal biopsy. As I have said earlier, Whipple's disease is a great mimicker of many diseases. So what type of biopsy we are going to do is diffuse intestinal biopsy. And it's going to be a 5-quadrant biopsy, minimum of 5-quadrant biopsy. So here comes another question, where you will be doing diffuse intestine and which diseases you will be doing diffuse intestinal biopsies and focal biopsies. Also an important question that has been repeatedly asked. So Whipple's disease is one disease where we will do diffuse biopsy, and abetalipoproteinemia is also another malabsorption syndrome in which you will going to do a diffuse intestinal biopsy. An interesting fact is that in abetalipoproteinemia, that the fat soluble vitamins A, D, E and K, these are the main things that is going to be playing a role in the manifestation of the symptoms of abetalipoproteinemia, and among them vitamin K is the earliest one that is going to manifest, which is going to manifest in the as a deranged coagulation profile, and bleeding manifestation can also occur. To address that, even in Whipple's, rare thing to occur is GI bleed. This is a rare manifestation, but it has been reported. Whipple's has, in the patient with Whipple's, GI bleeding has been reported. So moving on to our biopsy, so where we will do focal biopsy is more important than a diffuse biopsy. So what are the places you will do focal biopsy? This amyloidosis, intestinal lymphoma, Hirschsprung's disease, and intestinal lymphangiectasia. So these are the conditions where you will do focal biopsies. So in biopsy, what you are going to find, that's also we have discussed early. So I will show you the histopathological slide and the features. So there is going to be a macrophage, involvement of the macrophage. The macrophage. So As in the question, it has been described four different types. So, what are the types? Type 1, type 2, type 3, type 4. So, what it basically describes is that in type 1 there is a high positive sustained positivity, and with there is diffuse granular type, there is the granular red deposits are more seen in the cytoplasm. Whereas in type 2, cytoplasm there is scanty whereas in type 3 it is almost lack the granules, and they faintly pass positive, faintly pass positive. And type 4 is foamy cytoplasm. So coming to the importance of this is that type 2 macrophages, that is the scanty granular, is seen after 1 to 6 months of treatment, whereas here type 3 is seen 6 to 12 months, and type 4 is almost associated with or consistent with remission of the disease. Understood? So type 3 and 4 is almost consistent with the remission of disease, whereas type 1 and type 2 there is evidence of active disease, ongoing disease process. So moving on to our MCQ. So type 3, type 4 macrophages in Whipple's disease is consistent with persistence. No, it is associated with remission. What you see is foaming cytoplasm. Type 2 and type 3 is associated with active form disease. Yes, true. So in general, intestinal histology has a limited value in prognostic value of the disease. So intestinal histology has limited due to this wide range of differences in the macrophages and the disease process. Intestinal histology too has a limited prognostic value or surveillance value in the disease. Whereas for diagnosis, it is to be considered gold standard, because there is no any role of or very limited role of MRI and CT. So due to the non-specific findings, it is not found to be that much helpful in diagnosis of Whipple's disease. So what does these pictures depict or show you? That first is the picture of the ribonucleic acids or with the fluorescent stain of the ribonucleosides RNAs of the Whipple bacteria, that is your Trophirema Whipple bacteria, which is stained the fluorescent stain, and it has been a rod like found in clusters, rod shaped found in clusters. So the same thing you find this is in electron microscope, rod shaped bacilli in clusters. This is the ugeoscopy of the duodenum, which shows the marked thickening of the plicaris No, the plicaris the mucosa. So the important finding that I want to show you here is this: the villi are present in Whipple's disease, whereas in your celiac disease there is villus atrophy. So it is an important differential diagnosis. In celiac disease there is going to be villus atrophy, whereas in your Whipple's disease there is villi, but the thing is it is flattened. Plus you going to find pass positive macrophages where in the lamina propria, which is extracellular lining found in between the basement membrane and the epithelium. This is the epithelium, this is the basement membranes. Okay, and this whole thing is your lamina propria, in which there is pass positive macrophages and diastase resistant. Pass positive and diastase resistant. So as you see here, this is the epithelium, this is the basement membrane, and you will find lamina propria, in which there is abundant pass positive macrophages. So other malabsorption syndromes such as celiac disease, there is villus atrophy, and there is crypt hyperplasia. Whereas in Whipple's, the villi is present, it is not atrophied, it is flattened. Plus there is pass positive macrophages and diastasis in the lamina propria, which is of diagnostic importance. In abetalipoproteinemia also, I have told that the symptoms itself will points towards that, in which that the A, D, E, K vitamins are important, and the earliest manifestation is going to be bleeding due to vitamin K, and in Whipple's, arthralgia is earliest to occur. So keep in mind and keep these differentiating points between the different diseases as your differential diagnosis, so that you can retain it for a longer period of time. So the last picture here, what does it show? What is this picture? You can identify anything? So this is a fish fluorescent in situ hybridization technique, which shows these are the epithelial linings spike, and this blue color, this blue one are your trophema villi with the macrophages. And these red color things are proteins in the basement membrane. So this is the lamina propria. This blue color, whole blue linings, red and green thing is full of lamina propria with pass positive macrophages. That is diagnostic of trophema villi. So we have discussed all the diagnosis point, and coming to the management. Management, there is going to be there is in the initial earlier times there was a role of doxycyclines or tetracyclines, but now it has not been in current use due to the fact that it doesn't cross your blood-brain barrier, and we have seen CNS manifestation is still present even without evidence of GIT manifestation. In case of Whipple's disease, that is can occur as also isolated condition. It is due to the fact that they penetrate the blood-brain barrier earlier, even before entering your GIT. So hence CSF fluid analysis can show presence of bacteria Trophema Whipple'i. Here I want to tell about some of the staining process with this yellow color that is relevant to your yellow color, that is Warthin starry stain, is also been as of an important MCQ point. You must note that it is also used in cases of staining your weapons. For barrels, it is important. Yes, it's pylori and Bartonella. Bartonella and cat scratch disease. You must be knowing reading it in microbiology. So these are all other important points you must note it. So what is the drug of choice? Current drug of choice is that cotrimoxazole. For 2 weeks you give to 1 year, and currently they are also moving on with Zod, that is ceftriaxone as an injectables for first 1 to 2 weeks, followed by cotrimoxazole for 1 year therapy, since it is an chronic disease. So we are going to prognosticate the disease is by means of again biopsy, but it is I already told in histology it has a limited prognostic value. So there is going to be ongoing research regarding the surveillance and the prognostic indices for the Whipple's disease. So also I have discussed yesterday in more detail about the role of immunotherapies, immunes such as your Th2 response, increase intervals of Th2 response, and IRF4, okay, and HLA-B27. An important point I want to say is that in cases of arthralgia of Whipple's, there is rheumatoid factor negative. Now, I told that arthralgia precedes the GI symptoms, even the malabsorption symptoms in Whipple's. And to note is that the rheumatoid factor, RF factor, is negative in arthralgia or the arthritis of Whipple's. So thank you.